More people here are suffering from what's known as long COVID. The syndrome refers to residual symptoms which they continue to experience long after recovering from the disease. Doctors say they've noticed an up to 15% rise in such cases since February, which was the peak of the pandemic. Sherlyn Xia tells us more.
This COVID-19 survivor still feels breathless at times, even a year after recovering from the virus.
If I'm wearing mask, let's say I walk up one flight of steps, I'm literally really gasping, very, very heavy gasping. It was just so evident, how weak my lungs had become.
She's part of a small but growing group of recovered patients who continue to feel the after effects, such as fatigue, a residual cough, and at times even chest discomfort. Based on data from the National Centre for Infectious Diseases published last year, about 1 in 10 people report such symptoms up to 6 months after contracting COVID-19. The centre has been seeing such patients in its long COVID clinic. They were referred by GPs and hospitals. Over the last 2 months, the UniHealth chain has seen a 10 to 15% increase in long COVID patients.
This Omicron variant, people do actually present with long hauls COVID-19 symptoms per se. But in terms of the severity-wise, Omicron variant will still present as a milder form as compared to Delta. So while most of these COVID-19 symptoms are usually mild and not alarming, it is also important to know some of the red flags if you do experience them, and seek appropriate medical attention if these symptoms are actually interfering in your daily life.
These persistent symptoms are also more common in the unvaccinated.
I have seen cases of long COVID following patients who had COVID and they were unvaccinated. Many of them tend to be more significant. Sometimes the pneumonias take a while to resolve. They tend to have lingering inflammation in the lungs, for example. So in such patients, it is natural, it is expected that because of their initial severe illness, it is very likely they have prolonged symptoms despite recovering.
And because of these long-term implications, doctors advise everyone to stay vigilant even as COVID-19 becomes endemic.